Welcome to lesson number 7 of medical terminology on CNM Glass. I'm Christine Cartwright, and are you ready with your cards to begin? We're going to start with the upper body today, and for one card there might be multiple words, and I'll let you know as that time goes on. So for example, your first card will be eye. And the two roots for eye that you're going to memorize are occule, and ophthalm. So for example, with your previous terminology, if I say, go get me an ophthalmoscope, you know you're going to go get me the instrument that I can use to look into the eye. Our next one is ear. For ear, flip it over, and you're going to have A-U-R, R, and O-T-O, oto. So for example, when we teach you to take your tympanic temperatures, we tell you to pull up on the pinna. This is the auricle of the ear, R, and otoscope, the same thing. If I want to see your eardrum, I need the otoscope. Coming out of this root will be one specifically for hearing. And for hearing, you're going to know acousti. Acousti. So acoustic refers to hearing. With our mouth, know the root or, as in oral, or. Within your mouth are teeth, and you'll have dent and odont. So for example, the dentist takes care of your teeth. Odont, teeth. In your mouth also is your tongue. Glosso, tongue. And your gums. Gingiva. So if you've heard of gingivitis, inflammation of your gums, I know there's a lot of commercials about gingivitis. Furthermore, in our upper body and mouth, I think I'm writing too big. We'll see if this one will fit. For your cheek is bucco or bucco. So there's some medications that we give just inside of the cheek, and if you hear somebody say to give it bucco or buccoli, it's right inside the cheek. This whole thing is related to our head. And head is caput. Caput, head. Leading down to neck. Cervix. So when people talk about your C-spine, your cervical spine, we're talking about this area in your neck. Sometimes for women you hear reference to their cervix. It's actually the neck of their uterus. When your uterus comes down and there's that elongation, it's like the neck of the uterus. We're going to come further down the body now and learn a couple of words for your lungs. I know you know these because you've been using them in class. Pneum, like pneumonia, right? And pulmo. So if someone's talking about the pulmonologist or pulmonary, we're talking about the lungs. Pneum, the air in the lungs, okay, pneumonia. Your ribs, cost. So we'll talk about the costal or intercostal spaces. When we're going to do the 12-lead EKGs, if you haven't already done those yet, on those 12-lead EKGs, you're going to be feeling for that space between the ribs, and I'm going to teach you to count the intercostal spaces to figure out where to put those EKG leads. Also now we have pharynge, and that's the pharynx and larynx, and that's the larynx. So you might have heard of pharyngitis or laryngitis, talking about the pharynx and the larynx. If you want, you can look at it in an anatomy book and get specific with that, but just know that you're really dealing with internal structures here. Let's go back up to the head and talk about hair, which is trick. You'll see this sometimes in psych, people who bite and chew their hair, pull on their eyebrows and their hair. And then finally, we're going to talk about your sinuses. And sinus really just means hollow space, because you have multiple sinuses in here and they're actually just hollow spaces. You actually have sinus cavities in your brain if you didn't know that. So sinus doesn't always refer to just your nose. It really means hollow spaces in places. So I hope you had time to write these all on your cards. We will talk about combining these as we go through and do some activities in class. And good luck studying.